Welcome, everybody. My name is Bob Huttinga. I'm from the Healing Center at Lakeview. Barb and I operate this. We've been there about 10 years now. Today we're going to talk about reversing the diseases of aging. Everybody here is aging a little bit, and so we may or may not have some of those conditions. So I want to give you some things that you can do. I'm a physician assistant, almost 40 years now. Also a certified natural health practitioner, and I've studied a lot of homeopathy, and explain a little bit of that today. I like to start my talks with a little story. Some of you who were in the last one heard this. I worked in Alma at an urgent care, and this gentleman came in. He was 103 years old, very healthy. He drove himself to the clinic. He cut his finger working in his workshop. He'd been a builder, and he built his last house when he was 90 years old. And so I'm sewing up his finger, and he asked him, well, what's your secret? And he said, I stayed away from you dang doctors. A lot of people have that concept, and what's important about it is we need to teach people how to take care of themselves. And use your doctor as a coach. The doctor is not there to totally take care of you. He's there to give you advice, and it's your job to really take care of yourself. So today's little talk, we're going to talk about arthritis, diabetes, heart disease, and cancer. These are things that are very important to many of us. As we go through, if you have questions, please raise your hand, bring that up. If it's something I'm going to cover later, I'll indicate that. If it's something personal, you can ask me at the break or lunch. And we have a little newsletter that we put out every month or so. It's an email newsletter. If you have an email, put that on there, and we'll send you our email. When you get it, if you don't like it, it's very easy to unsubscribe. But we generally give good, helpful information. So the question today is, what is health? Most people say it's the absence of disease. Our definition is having enough energy to do the things you want to do every day without any limitations. And the focus there is on being healthy, not the disease, being healthy. So you're born with what we call your constitutional level of health. That's the result of your genetics from your parents and the effects of your mother's pregnancy. Your mother's nutrition, her emotional state, all of those things affected us. And then we go through our lives and we have emotional shocks and physical shocks. These events cause us to have these kind of ups and downs. And many people experience total recovery after an event, but sometimes we don't quite get back to our original level of health. And sometimes there's something huge and we don't recover from that. And so some of us end up being 40, 50, 60 years of age, and we have a very low level of health compared to where we started. I see people in their 40s that are absolute wreck. And most of you look pretty good in here. There's certainly a lot of people that have these issues. And then there are things that influence our ability to recover. So our immune system, our vital energy, spiritual resources, but there are often obstacles to our recovery. And these are deficiencies. So if you don't have enough minerals in your system, here's an example. If you don't have enough chondroitin in your diet, you're going to have joint pain because you don't have the ability to repair your cartilage. Excesses, too much alcohol, too much tobacco, eating too much stress, too many toxins. These things influence our ability to recover. So if we have an event, often we can't recover totally. And then finally, pathology. This is destruction of tissue. This is just a little review of that. This is where we start. The events that reduce our level of health, things that influence our ability to recover, and pathologic changes or damage. Now, in traditional medicine, it's problem-oriented, diagnosis is needed, focus is on laboratory and x-rays, and the focus is on the damaged tissue. Probably everybody in this room has had a doctor say to them one time or another, well, your tests are all normal, there's nothing wrong with you, and yet you feel like crap. So something is going on in the functional stage of things where there's no damage yet, but there are symptoms. And in traditional medicine, the therapeutic emphasis is traditional prescription medicine and surgery. Now, in natural medicine, and at the Healing Center, we do both. Natural medicine is health-oriented, and our focus is on these things, the deficiencies and the excesses. So the idea is to make corrections before pathology occurs. And the therapeutic emphasis is, not sure how to back this up. Therapeutic emphasis is on the root cause, trying to find the reason for something. And I'll give you an example. I had a little boy a number of years ago, 6 years of age, had a horrible separation anxiety. He couldn't be away from his mother. And when she would go take a shower or go to the bathroom, he would sit at the door and cry until she would come out. And it was very limiting. So he's 6 years of age, going to school. She'd have to drive him to school, drop him off, and the teacher would come and carry him into the classroom, kicking and screaming. It would take 2 or 3 hours for him to stabilize in the classroom. Well, the root cause was that at birth, mother was given a shot during the delivery for pain, something called Nubane, and she had a reaction to that, and she just about died. Consequently, the kid almost died, right? And he's separated from his life source, or at a survival level, afraid that he was going to die. And so this connection was very, very powerful between them. I gave him a remedy for narcotic reactions, and this totally resolved. So now he goes into school. And the first time, I guess the morning after we gave him that remedy, so the single remedy helped him, he jumped out of the car. The teacher is standing there looking like, what's going on with this kid? He runs back to his mother in the car, patted her on the hand, and said, "You're going to be okay." And went to school. So now this is an example, a very dramatic example, of a single homeopathic remedy fixing a situation. But if that cause had not been identified, this man would have had anxiety his whole life. Now, our other emphasis is nutrition, hygiene, supplements, herbal medicine, homeopathic medicine. And we like to use all of these things. We also use prescriptions, and I refer people for surgery because there are times when we need those things. So let's talk about arthritis. Arthritis, damage to a cartilage. Some people end up having to have these joint replacements. There's osteoarthritis, rheumatoid arthritis. There's a whole bunch of other kinds of arthritis. But our focus is really going to be on these. Osteoarthritis is the wear and tear. It is the breakdown of the cartilage. And as a result of the cartilage breaking down, bone spurs begin to form, and you get restricted motion. You start getting a lot of pain. Rheumatoid arthritis is an autoimmune disorder, and this is a condition where the immune system actually attacks your own tissues, causing damage. So when you have a nice, healthy looking joint like this, everything is smooth and slides and works very appropriately. But then you get a breakdown, and often what happens is there's an old injury. Now, if you have the right ingredients in your diet to repair this cartilage, that can totally repair, and you go on and you don't have any issues. But it never if it never totally recovers, then gradually, over time, it begins to deteriorate. And little pieces, the cartilage begin to break off, you get loose bodies, and you start having what we call arthritis. So, nutrition is a very important part of reducing the effects of arthritis. Acidic foods create inflammation. So, if you have an inflammation, then you want to do your best to avoid acidic foods.
Can I ask you a question, please? What is bone on bone called?
Well, that's where all of the cartilage has been worn down and now there's just bone touching bone. And that is a condition pretty difficult to recover naturally. But the idea is to catch it before. Now, if you already have bone on bone, you're probably stuck with a joint replacement at some point.
Yeah, when they replace it in the house, when we're talking about it's going to just be stiff.
Well, lots of people do really well. You know, I've had a lady recently had both hips done and she's dancing and
Oh, he's had his knees done and he's having a heck of a time with that. But now it's his wrists.
So the idea is before these other joints deteriorate, you got to do something about getting rid of the acidity and inflammatory foods. We use a system called Eat Right for blood type, and a good example is A blood types should not eat a lot of red meat. So you want to limit those acidic foods, pop, pork, coffee, acidic juices, black tea. These add to the inflammation in the joints. Dairy products, xanthine oxidase is a byproduct of homogenization, and it creates inflammation. High sugar, in some people, wheat and gluten grains. Okay. Shirley Hall. Now, exercise, very important in the reduction of arthritis. You need to keep these joints moving. A few years ago, I spent a year in a program called Self-Mastery, and we did some yoga. Now, I'd had a hip injury when I was a child, and so one of my hips was very stiff. But using yoga, I was able to put both heels behind my head. Now, I couldn't get the one up, probably past my waist when I started. So the point is that exercise, very important, stretching, strengthening, and aerobic exercise, very important. Now we also have to cleanse our bodies. So if we have a lot of toxin on board, we need to do cleanses. We need to drink plenty of water. Drink enough water so that your urine is clear or slightly yellow. If your urine is dark during the day, you're slightly dehydrated. What happens when you dehydrate? The cartilages can't function the way they're supposed to. There are some supplements. There's one, the brand name OsteoBiflex. It has 3 ingredients: chondroitin, glucosamine, MSM. This is what your body needs to repair and build new cartilage. So if you have joint pain, you're not bone on bone yet, but you have cartilage injury, you need to do this supplement. There's a couple of interesting things here. Most glucosamine comes from seafood, so if you're allergic to shellfish, you probably can't do this. Chondroitin may interfere with men who have prostate cancer, so if there's any prostate cancer in your past, you should not take this supplement. MSM helps break down the old damaged cartilage, so you need these 3 compounds to rebuild new cartilage. We have a product called Baxel. You can get it on the internet. It helps rebuild the lubrication in the joint. So if you've got a dry joint, it's going to wear and tear on that cartilage a lot. This helps put new lubrication in there.
Is that the thing the orthopedists put in the knee after surgery to replace cartilage?
Yes, it's similar to the injection Synvisc and some of those other compounds that are put in with injection, but this is done through the diet. and it's
For the what?
through your diet. You eat.
Oh, through your diet?
Yeah,
Okay.
you take it as a supplement.
Can you take these if you have high blood pressure?
Yes. Omega-3 fatty acids, natural anti-inflammatories, all of these are beneficial. There's something called noni juice. This comes from Hawaii, and it's very helpful. Tart cherry juice has been shown to be very helpful for reducing inflammation in the joints. If you have any bone spurs, you can take these two compounds, herbal hydrangea, 1 capsule 3 times a day, and homeopathic calcarea carbonicum, 1 pellet once a day. And it'll take about 3 months, sometimes as much as 6 months, but you can reduce these bone spurs. So if you have gnarled up fingers, you won't completely straighten them out, but you can reduce back the cartilage that has penetrated the ligaments that hold these joints together. When you do hydrangea, we recommend a 5 or 6 day vacation each month. So you take it the first 25 days of each month, and you take 5 or 6 days off, depending on the length of the month. The reason for that is herbs can lose their effectiveness if you take them for a long period of time. So if you take them 25 days on, 5 days off, 25 days on, that's a really good schedule. But that will dissolve some of those bone spurs. So we talked about this already, this homeopathic remedy. If you have pain and stiffness that gets better with motion, there's a homeopathic remedy called Rust Tox. This works very good for people that have joint pain, stiff, sore in the morning, but after getting up and moving for about 5 to 10 minutes, they feel better. Do one of these at bedtime. And the strength that you want is a 30C. So 30 with capital C, that's the potency of Rust Tox. Now if there's pain that gets worse with motion, then use the remedy Bryonia, also a 30C. So you kind of make that distinction of different kinds of pain. And pain related to new injuries, this just says injury, but new injuries, we use a homeopathic remedy, Arnica. This is very effective to help you get back to the level of health that you had before a physical injury. Yes?
I know there's different forms of arnica, you know, you can take it in a tablet or in a cream. If you use it in a cream, will it actually get to the source? Will it penetrate to where it needs to go?
Well, we usually recommend the little sublingual tablets.
Okay.
You can also get arnica tincture. Arnica tincture is poisonous, so you never want to take that orally. That's to apply. And most stores don't even sell it, just because there's some risk. So the little pellets are sublingual, they go under your tongue. Those work the best. But arnica cream, you can put it right on the joint, that's effective. And it does get through the skin. But I think that the sublingual pellets are better. So this just shows a little bone spur. A bone spur is just calcification in a ligament. A lot of people will have pain in that ligament long before the bone, the calcium grows into that ligament. So there's again a functional situation. You have pain in your heel, you get an x-ray of it, there's no bone spur, the doctor says, well, you got plantar fasciitis. Well, there's things you can do with plantar fasciitis, but if you don't, eventually you'll get bone spur. All right, questions about arthritis before we go on?
I have
Yes.
a question about that. Is it Baxyl, B-A-X-Y-L? If you're already bone on bone, is that even worth using?
You might try it for a month, but if you don't see any improvement, what I tell people is if you got bone on bone, do the osteobiflex and Baxyl for a month and see what happens. Some cases we've seen some recovery, but most of the time, if you've got bone on bone, those cartilages are a quarter of an inch thick, and if they're worn down to nothing, probably too late. But it's worth at least 1 month to tried that. I've had numerous cases of people going for an arthroscopic surgery to clean up the joint, and they start taking these things, pain gone 3-4 days, they can recover or cancel their surgery. So there are lots of things that you can try, but bone on bone is kind of a bad deal, but that's something that's been going on for a long time. So type 1 diabetes, that's the lack of insulin production. Type 2 is caused by what we call insulin resistance at the cellular membranes. Now, these things are really aggravated by too much carbohydrate in the diet, and we're finding now that sugars, starches, some of the grains are a big factor in that. The grains in the grass family, this includes wheat, corn, rice, millet, almost all of the grains have gluten in them, or gliadin, or glutenin. And these three compounds have a part of their structure that can fit into an insulin receptor. So every cell is covered with these insulin receptors. And what's supposed to happen is the insulin goes into that lock, turns the key, and it turns on a sugar pump, and sugar gets transported from the blood into the cells for energy. But if these compounds that look enough like insulin to fit into that lock are plugging that, now the insulin can't get in and you can't transfer the sugar. So for some people, particularly O blood types, we always put them on a no-grain diet for a couple of months, and we're seeing some really good results with that. If you're interested in that, just send me a note. I'll send you a little article, a list of grains to avoid. The things that you can have on a no-grain diet are buckwheat, something called amaranth, arrowroot, that's a flour, quinoa, chia flour, coconut flour, bean flour, potato flour. So, you know, that's a pretty short list of things that you can have. But if you are diabetic and you do it for a couple of months, lots of people are seeing some good results. So we think that type 2 diabetes is really very curable with nutrition and weight control. And, you know, it's very interesting. We don't promote gastric bypasses, but people that have had them, often their diabetes goes away. So eliminating these high carbohydrate foods and weight control, very, very important. Now, high insulin causes inflammation. And what happens when you have type 2 diabetes is you actually overproduce insulin, trying to keep the sugar under control. I once had a young girl, she was 17, a little on the heavy side. Her mother wanted her checked for diabetes because of family history. So we did a blood sugar, we did an A1C, which is the average sugar of the last 3 weeks. They were normal, but I also did an insulin level. Now, normal insulin level is 0 to 17. Hers was 195. So this kid is pre-diabetic. She is over-making insulin, and eventually her pancreas will wear out, and she'll become a type 1 diabetic. So this is just waiting in the wings, and getting her off the grains has made a huge difference. So this little beer belly is something that many of us have to deal with. It's actually a very unhealthy condition, and it's almost always associated with diabetes. Now this is a complicated slide. I'm going to explain it a little bit, but just to give you a couple of pointers. A healthy diet, you get a healthy absorption of sugar and a healthy production of insulin. So you get a bunch of food in your system, lower carbohydrate food, you get sugar in your blood, your pancreas releases insulin. Insulin fits into these little insulin receptors. The receptor sends a signal into the cell. Little sugar pumps get installed into the membrane, and sugar gets moved into the cell. This is what gets blocked by gliadin and gluten and glutamate. In this case, where there's a really high carbohydrate on the healthy diet, there's big sugar surges, and this actually can damage some of these insulin receptors. So now you don't get as many sugar pumps in the membrane as you do here, and consequently this cell is starved. Now it's going to send signals to the brain to eat more because it needs energy, and so you're going to have this sort of vicious cycle of eating more carbohydrates, higher sugar, higher insulin, and the whole thing just spirals down into eventually type 1 diabetes. So the nutrition of diabetes, we use the Eat Right for a Blood Type program. We also use the ApoE gene diet. Unfortunately, this takes a blood test. But one of the things we recommend is eating every 3 hours, and all meals and all snacks should contain all 3 food groups: protein, fats, and carbohydrates. I see people doing restricted diets, low fat, no carbs. We need all of these things. They're all part of the building blocks of our body. So a diet that is totally restrictive of a group is not healthy. So what we usually recommend is you create a little schedule. I eat at 7 in the morning, 10 o'clock I have a little snack, I eat at 1 o'clock in the afternoon, 4 o'clock I have a little snack, and 7 o'clock we have dinner. And these are all small meals, and the snack is small yogurt or some fruit with a little peanut butter. And these things, your body needs fuel on a regular basis. We have to think of food as fuel, not entertainment. Unfortunately, a lot of us are in that entertainment business. And reducing these high glycemic foods. Now, if you go on the internet, you can look up something called the glycemic index. The glycemic index is a list of foods that has the relative sugar content in all foods. So they use pure glucose as 100, and then sugars are assigned, our foods are assigned a value based on how much sugar value they have. For example, table sugar is like 69 or 70, but it helps you to select foods that have a lower glycemic index. Watermelon, for example, 95. Now, so a little piece of watermelon is good, but if you have 3 big pieces, you really loaded yourself with sugar. Other fruits like apples, oranges, things like that, a lot less sugar. So that's a really good resource. It's called the glycemic index. Unfortunately, this is something that we're starting to see. Is a lot of, and in medicine now there's a term called diabetes. So they've actually named the condition. Chromium picolinate, 500 micrograms per day. That should be the maximum. That's very helpful if you are diabetic. We have a product called Sugar Ray that has 5 herbal components to it. And we use this, sometimes people come, they're early diabetics, they don't want to take prescription medicine, and we use this instead and then start on a weight reduction program, and we've seen pretty good results with that. We recommend that you use stevia, pure cane crystals, honey, pure maple syrup, xylitol as sweeteners rather than NutraSweet's Slimness saccharin. One little caution here, if you do use xylitol, xylitol is poisonous to dogs. For some reason it's not healthy for their system. And so if you have a dog or cat, use xylitol, don't feed them any snacks or table foods that have xylitol in them. Any questions on diabetes before we go on to arteries?
How do you tell what diet you should be on blood type? Is there a site to go to?
Well, there's there's some sites on the internet. You can buy a little book. So if you know your blood type, for example, what's your blood type?
I don't know. I got something at home that tells me about blood.
Okay, so you know, if you know your blood type, then you can buy a little book. They're about $5 or $6 that lists all the foods, excuse me, and they're listed as beneficial, neutral, or avoid. And these lists have been researched pretty well. We did some study with Dr. Peter Diadamo, who did all this research, and it's really quite fascinating. If your parents are O blood types and you're O blood type, then those lists are going to be very accurate. If your father was an A and your mother was a B and you're an O, then you're going to be kind of a combination, and it doesn't work right.
I got to know your parents' blood type.
Yeah, a lot of us don't know that.
And the sugar, I heard somewhere where you get 25 be allowed 25 milligrams of sugar a day. But when you look at bread, like one slice of bread, it's got like 2 milligrams, so would I have to add up? Just watch my.
Well, you know, people do a lot of this counting and things like that. I don't promote that at all. I think it's way too focused, and I think our common sense can really help us a lot. If you do calorie counting, it's okay. And some people are very good at that, but most of us just can't keep track of that. So it's not very practical.
Is there like how many milligrams of carbohydrates you eat a day? Does that really mess up your diabetes if you have a lot of too much carbohydrates?
Yep, too much carbohydrates. If you, it depends on where they come from. Also, if you have a baked potato, white potato versus sweet potato. Sweet potato might have the same caloric value, but it has a lot of fiber, much more fiber than a white potato. It's digested slower, it's managed differently, and so it's less of a risk for diabetes than a white potato. Normal white potato, baked potato, average size, is the equivalent of 8 teaspoons of sugar. Most people think nothing of eating a baked potato with a meal, but you wouldn't sit down and eat 8 teaspoons of sugar, would you? So some of that is just research, and you know, if you look around, especially if you go on the internet, you can get some pretty good information like that.
What does chromium do?
Chromium helps that insulin resistance. All right, let's look at plugged arteries. This is kind of an old concept. We used to think that plaque go up inside of the lining. It actually doesn't do that. Oops. Let me go back. I'll show you in a minute how that works. This book called the ApoE gene. This is a very interesting concept, and I'm going to explain that a little more in a minute. There's 3 genotypes. This does require a blood test. And about 63-64% of people are in this group, what's called a 3-3, and 2-2, 2-3, 3-3. So you get these 6 variations. And what's interesting is that when you have a particular genotype, your body handles foods in a really quite a precise way. Now, I'll come back to that in a minute. These are the different types of cholesterol. So you have very low density lipoproteins. That's what VLDL means. And these are large, fluffy molecules. The LDL, actually there's 7 different sizes. And then down here you have HDL. And there's 5 different sizes of that. Let's go on and I'll show you the significance. When you have these small LDL molecules, they are so small they can get underneath the lining of the artery. So the artery wall is an outer lining, a muscle layer, and an inner lining. And that inner lining is sort of like patio stones. There's a little space in between the cells. Well, these hard, dense LDL molecules can get underneath there, but the large ones cannot. So what happens is this is the normal looking artery, and you begin to get the small LDL molecules getting under the lining, and eventually the plaque is built up underneath the lining. And ultimately, then you get blood clots that form here, and you can get arteries that are 80, 90, 95% blocked. If you have a balloon and a stent put in, what they do is they push this thing open and put a stent in there to kind of hold it open. And technically, that's a very life-saving procedure for many people. The idea is to prevent that from happening by keeping the LDL molecule size larger, and so you don't get this buildup of plaque underneath the lining. So I'll go back to this one. These 7 different sizes, some of them are very small and very dense, some of them are larger and fluffier, and the big ones, they can't get underneath those linings. So if you have a standard cholesterol test, to give you an example, I have a patient whose total cholesterol is 393. But when we did this fractionation test, 90% of them are the large fluffy molecules. Now she had a bunch of digestive issues, chest pain. She ended up with having a heart cath. She had 5% plaque in her arteries. So it's a good example of how this high number really doesn't mean anything unless you know what this fractionation is doing. We also see people with normal numbers, 200 total cholesterol, but they have mostly this, and these are the people that have heart attacks even though they have normal cholesterol. Now what causes you to have these hard dense ones or these large fluffy ones? Well, that's depending on your genetic ApoE gene type. If you're a type 2, you need a higher fat diet. If you're a type 4, you need a very low fat diet. And type 2s can handle a little alcohol, type 4s cannot handle any alcohol. So if you're a 4 and you're drinking it every day, you're going to have these hard, dense ones, and it's going to accelerate this heart disease. Now these tests are not done traditionally, but they're starting to filter into the literature and conferences, and it won't be too long and your doctor will order this fractionation test, and it'll be much more precise. This kind of gives you a little summary of that. The 2 3s, they need higher fat in their diet, they need low carbohydrate, and this folks can handle a little alcohol. Over here, very low fat diet, they need higher carbohydrates, and they can't handle alcohol very well. Here's a couple of examples. This is a guy named Rick. He started out with a low cholesterol, 140, and after doing this diet for 12 weeks, his cholesterol was 173. But interestingly, he lost about from 190 down to about 165. The body fat percent went from 24 to 7%. And this is just by changing his diet based on this genetic type. Here's another example, Dora. She started out with a total cholesterol of 489, and she'd had reactions to all of the cholesterol-lowering medicines, and so there was a bunch of frustration about how to treat this. She was found to be a 4-4. She started on that, and after about 2 months, her total was down to 214. HDL was about the same. Her LDL was down to 142. We don't have the information on her fractionation, but it's a really good example of how that can make a huge difference. She only lost a little over 10 pounds, but her numbers changed dramatically.
How long has this test been around? I know it says 2005 that she took this test, but it's been around longer than that.
It's been around for at least 15 years.
Okay.
Not at all accepted, but it was done by Berkeley University, and all the research, about 30 years of research at Berkeley has been going on regarding this. And now it's just starting to filter. Quest Diagnostics bought out that program at Berkeley, and so now they're out there actually promoting it.
So if you request your doctor to do that, they're gonna say that's not covered by insurance.
And they probably won't even know what it is.
Oh, okay.
But it's coming, they will. My guess is 5 years or so it'll be available. They do some typing now of different types of cholesterol molecules and numbering them, but it's not exactly the same. If you have an interest in that, we can do that for you. All right, so heart disease. Damage happens in those arteries also by free radicals. Free radicals come from smoking, air pollution, microwave cooking. A free radicals molecule is missing an electron. And so when it bumps into the cell wall, some electrons are taken off the cell wall and that starts causing some damage. I'm going to speed this up here a little bit. Things that help prevent that are vitamin C, vitamin E, omega-3 oils. Some of these products like Zango and Hygo and Ginger Red, those are very good antioxidants. Beneficial to eat every 3 hours. There's a movie called Super Size Me. It's a very good movie to watch. This was a guy that ate at McDonald's 3 times a day for a month. Gained 27 pounds in a month. His cholesterol went from 170 to 240. Took him a year and a half to totally recover from that 1 month. Avoiding trans fats, avoid high sugars, omega-3s, flaxseed oil, fish oil. Avoid decongestants. Pot, coffee, decongestants, tobacco. These are stimulants. This word here should be avoid stimulants. Things that say D on them, Claritin D, Zyrtec D, should not take those products. They're vasoconstrictors and they cause lots of damage. Chronic use of non-steroid anti-inflammatories, Motrin, things like that have been found to be very damaging to your tissue. Let's do a quick thing here on cancer. Normal cells are very kind of regulated. You can get hyperplasia, that's where these cells start to become irregular, dysplasia, and then carcinoma in situ, and then actual carcinoma. So a good example of this is when women have pap smears, quite often the reports come back, dysplasia, hyperplasia, carcinoma in situ. This takes years for this to occur. In some places, like the pap smear, we have a test where we can watch this for 5, 6, 7 years before they become cancerous. So some of these preventive tests are very beneficial. So nutrition, again, acidic environments promote cancer growth. And what are acidic producing foods? Pork, pop, acidic juices, dairy products, homogenized dairy products, high sugar foods, coffee, black tea. Those produce acidity in the body. It takes 400 milligrams of calcium to neutralize 1 cup of coffee. Avoiding food additives. We'll skip that. Emotional causes of cancer. Living and working in a situation that you hate. Anything that creates this kind of anxiety, fear, frustration, creates an acidic environment. You need to fix those things. One of the preventive things for breast cancer particularly is daily breast massage. It's very simple. We often have people do this in the shower. Cup the breast in your hands, up and down 10 times, side to side 10 times, round and round 10 times, round and round the other way 10 times, and then a little massage out to the armpit. And it moves all of the lymphatic fluid and congestion that's built up in the breast during the day. It moves it out. You should do this daily. With men, I don't think I put it on here, with men we recommend testicular tapping. Same thing, tapping the testicle, 10 times on each side every morning when you take a shower. Not too hard because that's painful, but just a little tap is very beneficial. Avoiding the sun between 10 a.m. and 2 p.m. Also avoid burn and peel type of sun exposure. That's really where the skin cancers happen, is this burn and peel. Exercise every day helps burn toxins off. There are certain fat-bound toxins that can't get out of our systems except through our lungs and through our sweat. So exercising to the point of sweat or deep breathing is very helpful to get rid of these fat-soluble toxins. Avoiding smoking, excess alcohol, overeating, and toxins. Stress management, meditation, extremely important. Talking about stress management, I put together some CDs a few years ago to help people relax. Also, we've got some other CDs, smoking cessation, virtual gastric band is for weight control, pain management, sleep. Pay attention, this one's for kids. This is for people with habits they'd like to change. I wrote a book a couple of years ago called Put Your Health in Your Own Hands. Put your hand under the table you're sitting in and see if there's some little surprise under your desk.
Yeah.
There's one. What's it say?
Book.
Okay.
Thank you.
Get a prize. Anybody else? Robert, you're in trouble. Well, just because you don't have one. All right. So, I got another book coming out here shortly. It's called How to Create an Amazing Life. And if you're on our email list, we'll let you know about that. Supplements for cancer, something called Pawpaw. ECAC tea comes in capsules or actually powder. We've had about 6 cases of bladder cancer that have completely cleared up using ECAC tea. So if you know anybody, that's we also use it in other forms of cancer. Alfalfa tincture is very beneficial for people that are having cancer treatment that are kind of weak and a loss of appetite. Homeopathic remedies. When people get a diagnosis of cancer, the shock of bad news is actually very detrimental. And for some people, depending what they believe, they're dead when they hear that because they believe they're going to die. Now, lots of people don't believe that. They know somebody who got better from their kind of cancer. They believe they're going to be fine. They've got a purpose for their life. But we use a homeopathic remedy called gelsemium that takes away that fear and that frustration from the shock of the bad news. We also have organ remedies that are specific to the organs involved. And we use remedies to deal with suppressed anger, shame, guilt, fear, grief, loss. I had a patient 6 years ago. She was in my office to get put on hospice. The breast cancer is in her bones, in her liver, in her brain, and her husband had an affair 20 years before, and she had never forgiven him. And this was the source, the emotional source of her cancer. And I said to her, if there's any hope, you've got to go home and you've got to heal this with him. And I don't know exactly what she did, but I got a note a month later from the oncologist that she was doing better. And without any treatment, her cancer disappeared. So her body, her immune system, knew how to get rid of the cancer, but this fear, anger, frustration, resentment, those emotions were actually stopping her immune system from doing what it was supposed to do. So these emotions are extremely important to get them taken care of.